I'd like to begin our podcast by respectfully acknowledging the traditional custodians of the land on which we record this podcast and pay our respects to the elders past and present. We recognise and honour their ongoing connection to land, waters, culture and community. We extend that respect to all Aboriginal Torres Strait Islander people listening in today. With 4 in 5 Australians experiencing back pain at some point in their lives, we know that back pain doesn't just affect the body. It affects how people move, how they work, how they connect with family, and more importantly, how they feel mentally and emotionally day to day. Today I'm joined by Barbara, a patient who has navigated persistent back pain, not just the physical symptoms, but the broader impact it can have on her mental health and well-being. This is a conversation about what it actually feels like to live with persistent pain and what can shift when people are supported to better understand the relationship between the spine, the mind, and their overall well-being. Welcome, Barbara.
Thank you.
Thank you for joining us today.
It's a pleasure.
So we could probably start by having you tell us a little bit more how you've been suffering from back pain. How did that come about?
Okay, I have a very long history of back problems. Approximately 15 years ago, I had spinal fusion because of degenerative discs.
Yep.
And that has meant that I have a weak, if you like, spine.
Yeah.
So I consistently have to have treatment and manipulation. I've also got arthritis in various other joints, which then impact on my spine, and the pain is pretty consistent.
Yeah. Okay. So tell me, how has that over time impacted your life?
It slowed me down. I'm not as mobile as I used to be, and it really has impacted on my mental health.
Yeah.
In that, on really bad pain days, I hide away. The depression increases, and I just don't want to be part of society when the pain is really at high levels.
Yeah, I can imagine. And I'm assuming that has just gradually over time eaten away into that aspect?
Yeah. Totally.
Yeah.
About 18 months ago, I had a major fall.
Oh, I see.
Where I not only injured my hip and my shoulder, but I also injured my back again. And so that meant that, my recovery was very slow because it wasn't just the pain, it was the impact it had on my health and well-being.
Yeah.
The depression really hit, and I really went deep down into a horrible depression.
Yeah, so it was much more than just the physical pain, would you say?
Yes, absolutely.
Yeah. I think things like stress, emotions, and your mindset have a huge bearing when it comes to persistent pain.
Yes.
Can you elaborate a little bit more about how that's impacted your overall well-being, just the nature of the stress of it all, the emotions tied to it? I know you touched on it.
Yeah, I tend to withdraw. So it's limited my social interaction. I don't go out as much as I used to because if I'm in pain, then I'm not a really nice person to be around.
Yeah, I understand.
Even the grandkids say to me, Auntie Baba, you're not feeling very well.
Right, yeah.
And so it has an impact on my relationships as well.
Exactly, yeah. I can imagine that would be very stressful in itself, let alone the stress of the actual pain that you're experiencing.
Yes, absolutely.
Yeah. Now, I believe you participated in the MindSpot Pain Program.
I did.
Which is a free online psychological service with qualified therapists.
Yep.
When your clinician suggested trying MindSpot to help you manage your pain regarding obviously the chronicity to which you've been dealing with it, what was your initial reaction to that?
Yes, please.
Anything to help.
I did. I wanted to look at different ways because working with my chiropractor, who absolutely trust, and dealing with the physical aspects, I knew there was another part that really needed to be addressed, and that if you like, normal psychologist might not be able to correlate the pain as well as the psychological impact. So I was really very happy to say yes.
Oh, that's fantastic. So it's great to see that you weren't too sceptical or unsure about embracing that.
No, I've been in all sorts of different therapies, I'm very self-aware. Sometimes when I'm in pain, I'm not as self-aware, but And I also understand the processes because in my professional career, I've worked with people extensively and helping them deal with work life and a whole range of issues.
Yeah.
So I knew that if this was a sound-based program, that I would be in good hands.
Okay, I see. Did you find it engaging, or did you find it challenging to stick with the MindSpot?
Oh dear, I was looking at it with two heads.
Okay.
I know that sounds weird, but I was looking at it and experiencing it as a patient.
Yeah.
But I was also experiencing it as a professional trainer.
Oh, I see.
So I had to really immerse myself as the patient.
Yeah.
But once I got into it,
You really.
I really was engaged.
Yeah,
yes.
fantastic. It's great to hear. Were there any specific tools or insights that really shifted the way you understood or managed your pain once you've engaged in that MindSpot program?
Yes, I think it was about the second or third module where they were really talking about, I think, over or under activity.
Oh, I see.
And when I'm in a lot of pain, I don't want to do anything.
That's understandable.
I simply want to hide away.
Yeah.
But what I got out of it was actually programming activity. So that even if it was domestic things, I would say, okay, tomorrow I'm going to do laundry, I'm going to do some art therapy,
Okay.
and actually program things in that gets me out of the sofa
Yes.
from that, if you like, underactivity. And that really worked for me.
Yeah, right, I see. Okay. Did accessing the program online in your own time make a difference? Because I can imagine that obviously if you're busy doing a lot of the other things as well, that time's a big issue. Did that make a difference having it being accessible online?
Well, I'm retired, so time isn't quite such a problem for me. But I really like to be able to do it when my brain was most active. So for me, I'm a morning person. So I was able to do it mornings when I felt really good. Late at night, I would look at it and go, no, I don't think so. I don't want to talk about pain at 8 o'clock at night. So that was really good. And my other thought was, that's really what training is done in the workplace like that now. So it is done in modules. It's done when you can actually access it for yourself. So I was very comfortable with that.
Perfect. So that online aspect was obviously very useful.
Yes, yes.
From the therapeutic relationship aspect and also trusting your clinicians, we know that chiropractic healthcare is focused on holistic care, where we treat the cause and not just the symptoms. How important was your chiropractor or your clinician's recommendation to motivate you to give the program a real go?
100%.
Yeah.
I was learning about the program from him. And the way it was introduced was really as a positive adjunct to what we were doing in terms of the physical work on my back and other parts. So I was really very comfortable with that in the way it was introduced. And it wasn't done as a sort of, as in the past I've experienced with people saying, you've got to do this for your own good, at which point you go, no. This is a positive way in which I think you can gain something from this. And I was very comfortable with that.
Oh, fantastic. If we look at from the perspective of your experience, unfortunately, access to the sort of psychological supports within routine musculoskeletal healthcare still remains quite limited. Are you glad that you had the opportunity to participate in the MindSpot program?
Absolutely.
Yeah,
absolutely.
And I'm assuming that you would highly recommend that to all those who are in the same position.
Yeah.
Yeah.
It really helped me shift out of really what I would call a slump.
Yeah, I see.
And even though I'm self-aware and I understand what's happening to me in both mind and body, it was the kick up the that I
Backside.
actually needed.
Yeah.
The other part that was really beneficial was the half-hour sessions with the psychs afterwards. So where I could actually talk through some of the issues that were being raised through the online program. So that was very useful in terms of the program.
So nowadays, how do you see the connection between your physical pain and the mental, emotional health aspect of it all, having gone through that?
They are so connected.
Oh, wonderful.
They really are so connected. And again, just to give you an example,
Please.
My back pain is pretty severe.
Yeah.
And yesterday I was sort of sitting thinking, I'm going to do something. Yeah. So I actively went, and I do art therapy.
Yeah.
So I actively went to my easel and spent an hour painting. Mm-hmm. And halfway through I'm going, my back doesn't hurt.
Bonus.
Yeah, it was amazing because I had completely let go of the
pain
that used to, and the pain is there.
That thought background in sitting in there, always there's pain.
Yeah,
there's
the
pain.
thought process I lost myself in the art, and it was going, it's fine.
Yeah.
Then I got up and walked around, and
clearly it's worked.
Didn't take that bit out.
Okay, the big question is then, do you find that the MindSpot program, coupled with your regular physical treatment with your chiropractor for your back pain, made a difference, would you say?
Absolutely.
Yeah, and I think that's a fantastic result. We love hearing the integration between those different modalities, so that's fantastic. What would you say, I guess, looking at someone else suffering with back pain and mental health issues, obviously they can be intimately tied together. What would you say to them? What sort of advice would you give them?
Bite the bullet and do it.
Simple as that, right?
Look, it can be scary.
Yeah.
If you haven't experienced therapy or counselling or anything like that before, then it's hard to trust the process.
Sure.
But be brave.
Yeah.
Do it and make the most of the follow-up therapy sessions to talk through the issues that are raised on the modules. The other thing about the modules was the fact that I could download the content afterwards and actually go back and have another look.
Okay.
So that, and again, for example, I was thinking about this last week, and I went, what was it in Module 3 that said about distraction and activity? So I went back in and had a look, and I went, oh, yes, of course.
Yeah,
So it's not just doing it, it's the follow-up afterwards.
Oh, fantastic. Yeah, it's great to have that resource to be able to go back on reflection as well.
Yes.
Okay. Oh, sounds like a very positive experience. Thank you for your insights today, Barbara. I really appreciate your time, taking the time out to speak to us today. Just a reminder to our listeners that June is National Spinal Health Month. This marks 30 years of the ACA Spinal Health Movement, an initiative that is dedicated to improving the spinal health of Australians of all ages. This year's theme is Healthy Spine, Healthy Mind, getting back to feeling good. So the ACA are inviting the general public to be part of the movement to help Australians get back to feeling good. So join the Spinal Health Movement by registering your support at spinalhealth.org.au to access a free range of resources to help prevent back pain and while reducing the impact on mental health and those affected by it. So again, spinalhealth.org.au.